wildlife rescues and rehabilitation, and treated displaced and injured wildlife such as sloth bears, leopards, elephants, tigers, reptiles, birds, and many more. And today, Dr. Shah is going to be presenting on health and disease management of sloth bears. So Dr. Shah, please share your presentation. Thank you.
Very good morning to everyone. Thank you so much for the opportunity given to me by Asian Elephants and Heidi Riddle and then Life Trust India, Dr. Daniel. So I just wanted to share my presentation. Is my presentation on a full slide mode?
Yes, sir. Yeah.
So once again, a very good morning to everyone, and thanks to the organizers. Here I am going to talk about health and disease management of sloth bear. And in this beginning slide only, I would like to give some basics about sloth bears, and they are called as Indian bear. They are Myrmecophagous bear species native to Indian subcontinent, and it shares features of insectivorous mammals and evolved during the Pleistocene from the ancestral brown bear through divergent evolution. So the sloth bear is the most widespread bear species in India, where it mostly occurs in areas with forest cover, low hills, bordering the outer range of the Himalayas from Punjab to Arunachal Pradesh. It feeds on fruits, ants, and termites, and it is listed as vulnerable in IUCN Red List, mainly because of habitat loss and degradation. And in Indian Wildlife Protection Act 1972, it is a Schedule 1 species. And sloth bears breed during spring and early summer and give birth near the beginning of winter. And they often give 2 to 3 cubs at the max. And they don't hibernate, unlike our other bear species. 2 subspecies are there predominantly in sloth bear. One is Melursus ursinus. The other one is Melursus ursinus inornatus, which is found only in Sri Lanka. So in Sri Lankan sloth bear, they're phenotypically they are very smaller, and then basically their skull is smaller with a low length of condylobasal area, which will be more in males and which is little lesser in females. And it has much shorter body hair and sometimes lacks the characteristic white blaze mark on the chest, which is very much predominant in Melursus ursinus, and which is available in the whole Indian subcontinent. So I really would like to acknowledge all my teachers and mentors, all my State Forest Department, where we were part of the projects, and they have given us a collaborative effort to look after these rehabilitated bears, especially in the part of Uttar Pradesh, Karnataka Forest Department, and Madhya Pradesh Forest Department, Maharashtra Forest Department, Chhattisgarh, and Tamil Nadu Forest Department. And of course, my parent organization is Wildlife SOS, and the vet colleagues, especially Dr. Ilayaraja and Dr. Ashwarendra Singh and Dr. Sriram and Mr. Srinu, and all my vet colleagues, and especially the animal care staff, I really would like to acknowledge for all the efforts and also the effort they put in giving upkeep of these animals, and we learned a lot through all of them. So I just wanted to start with my captive wildlife welfare slide, because the theme is basically a captive wildlife welfare. So I just wanted to touch upon the subject of captive wildlife welfare. It means physical, emotional, and environmental well-being of wild animals in captivity. So as we all know that unlike the free-ranging wild animals, captive wild animals have got a lot of restrictions because they are in a controlled environment. So it is very much important for us to understand their behavior, and they have to lead a healthy and stress-free and naturalistic life and to improve their quality of life is very much evident and important with respect to captive wildlife management or welfare. So the primary goal is the species conservation. And the captive wildlife, as we all know, serves as educational awareness tool and research subjects to better understand animal behavior and needs. So based on that only, we can definitely improve the captive wildlife welfare. And eventually the results of the species will be definitely the species conservation effort will get into a better shape. And we must provide utmost care to these wild animals in captivity, and there should not be any harm to them, especially with respect to their behavior as well as their health. So I would like to talk about this in one more slide, the aspects of wildlife welfare in captivity. So there are major four aspects when we talk about wildlife welfare in captivity. The first one is the health. So that represents through regular veterinary care, disease prevention, and nutritional support. And the second important point is the enrichment, which is an environmental enclosure enrichments, provides opportunities for natural behavior so that they will be always given kind of freedom or even expressions to show their natural behavior, like playing, foraging, and social interactions. So the third important aspect is the space and environment. The adequate space that mimics natural habitat, clean environment, and comfortable enclosure. So those are really mandatory if you are really interested in addressing any welfare within the captive animal facilities. So the fourth a very important aspect of the wildlife welfare in captivity is mental and emotional well-being. As we all know, all animals are sentients in nature. So we need to address that part by providing a better mental and emotional well-being to avoid their stress and anxiety and boredom through enrichments and proper social structures. So these four components are very important aspects of wildlife welfare in captivity. So coming to the next part is the principles of captive wildlife management. So this, in a nutshell, we can bring the entire aspects into a major three principles, which is very important for the captive wildlife management, which are health, nutrition, and enclosure. So with respect to health, we all know that the regular health monitoring and checkups, being a vet, we will be more emphasizing on these aspects of health and preventive medicine. As we all know that prevention is always better than cure. And the vaccination and deworming procedures are very, very important to keep their health up to date and to avoid any kind of stress because of any kind of physiological or even psychological related activities or even situations. So the other part of the health is choice of antibiotics, the antimicrobial for specific organ system infection. So for example, if it is a respiratory related issues, we have to identify a specific antibiotics, especially through their samples, and then culture and microbial sensitivity test for antibiotics would be always a better choice instead of just randomly using antibiotics of higher grade and then get into a problem of microbial resistance. So it is always important and very, very evident that the judicial use of antibiotics or antimicrobials are very important. So if we can conclude the problem areas, as I said, whether it is respiratory or GI or reproductive or skin or dental or ocular, so depends on the specific organ system. If you could select the antibiotic, it will be more sensitive and more specific, and we don't need to use indiscriminate antibiotic regimes in any captive wild animal. And of course, the prophylactic measures like even hygiene and then the preventive care and then biodisposals and biosecurities, all those things are very important. So those are primarily comes under the prophylactic measures, which includes even our quarantine protocols. So the second important principle is the nutrition. We always emphasize on species specific diet, considering gender and age. So which is very integral component of this captive animal management. And the feed supply to animals should meet nutritional and functional needs, because as we all know that nutrition in wild animal was not so established, because it is very difficult to conduct any experiments or even to do some kind of controlled environment, or even making a metabolic cage studies. All those things are literally difficult. I mean, at least in India, if I am not wrong. So it is very, very important, and we should give emphasis on the natural feeding or foraging behavior of the wild animals representative species in order to get some kind of scientific approach towards the nutrition in captive wildlife. So the feed supplements to address nutritional deficiencies or specific requirement is also a very integral part of this captive animal nutrition, because many at times we will not be able to address all the nutritional requirements with a given food, because many times our food choice will be based on the locality and based on the available foodstuffs and based on the economical situation of the particular facility, whether it is a zoo or aquarium or even a rehabilitation center. So it has got a lot of components, I mean, parameters to give constraint to address this adequate food supply. So a vet should definitely give importance to add some kind of nutritional supplements to avoid any kind of deficiencies. It may not be a direct deficiency, or it may be an indirect deficiency. So nutrition plays a major principle with respect to captive wildlife management. The third important principle is the enclosure. As we all know that the enclosure has got a lot of standards, and then every province or even every country might have their own regulations to give a minimal standard space requirement for each and every species. So with respect to that, especially in India, we have a central zoo authority which governs all the captive animal facilities with respect to their enclosure, or even the health and nutritional based SOPs and guidelines are provided, which is always available online. So any vet within our country can definitely take guidance from the CZA manuals, or even their blue books, to check their standard housing measurements, and also how much space is required for individual animals or a pair of animal or a group of animals. So it has to be followed, not only for the sake of the following guidelines of some authorities. It's definitely to give better quality of life to the species. So it is very important for a vet to understand the importance of the enclosure size in order to get a desired behavioral pattern or even behavioral expression from an individual species. So especially for sloth bears, they always need more space, and then though they are solitary in nature, but they tend to be friendly with other animals, other gender especially. And when they are in group, they will definitely express and then do a lot of social activities, and also the social interactions, which make them more happier and then reduces their stress level. Eventually, the health will be always upfront and then fine when it comes to any kind of veterinary care. The other enclosure aspect is the safeguarding. So enclosure barriers, if it is a zoo premises, they generally make a moated or even a dry or wet moat barriers, and sometimes power fence, the solar power fence barriers, or sometimes even the chain link mesh barriers, which will be very safe both for the animals as well as the staff or even the visitors coming to see the animals. And other important part is sanitization and disinfection protocol of this any captive facility is a primary importance if you are trying to control any kind of spread of diseases or even emergence of any pathogens. Because as we all know that the disease has got three primary components: is the host, the environment, and the pathogen. So to control and keep all these three components in track, it is very important to manage the enclosure very well with a proper sanitation and disinfection, so that there won't be any underlying factors to make the animal ill. the last important enclosure aspect is the enrichment. As we all know that enclosure enrichment and environmental enrichment plays a major role. And there are enrichment itself is a big subject. We can definitely talk for a whole day. But since these principles included this enrichment, so I just wanted to touch upon the enclosure enrichment aspect as well. So when we are entering into this health and disease management of any captive facility, I just wanted to give you a glimpse of those terms so that we will be familiar with that. The animal health means the state of physical and psychological well-being and productivity. So this is something a very simple and then a straightforward statement that the physical and the psychological or even behavioral well-being of the animal is the expression of the health. And whereas the animal disease management means the process of preventing, treating, and controlling the disease that affect animals. So this is the disease management. How are we going to manage the disease? To understand the process of preventing and treating and controlling these components or the disease management. And wildlife health and disease management in captivity is an important part of maintaining the well-being and the quality of the life of the animals in any captive facility. As I said, whether it is in a zoo, or aquarium, rehabilitation center, or in any other controlled environment. Even if it is a conservation breeding center, then we have to have the same kind of rule that it addresses complete well-being and the quality of the animal. Only then the disease will not emerge or disease will not occur into any kind of captive facility. The effective disease management is essential to prevent outbreaks, maintain animal health, and ensure conservation efforts are successful. So this is a small glimpse of the health and disease with respect to the terms and understanding of the disease management. And coming to the common diseases in captivity, especially in sloth bears, so I just listed out few because there are multiple things which may not be common, but it can occur occasionally. But I am going to deal with some of the major diseases which we have encountered and then how we addressed those issues. So it might be practically useful for the captive animal vets in this forum. So out of these common diseases for sloth bears, we have the bacterial diseases of tuberculosis and leptospirosis, and viral diseases like ICH, infectious canine hepatitis, and herpes, and canine distemper, and we had a lot of outbreaks of rabies in our facility. And the other, the very minimal problem is the fungal diseases and hemoprotozoan diseases. And the neoplasm is another common area of the disease in captive sloth bears, not only in our country, across the globe, and we still have got a lot of unaddressed areas with respect to this hepatic neoplasms. So I'll anyway come to that in my particular slide. And the regular parasitic infections like internal or external parasites are also very common. It is easy to deal with, but still we need to understand the dynamics of this parasitic issues in captive sloth bears. And we do encounter some of the hormonal imbalances like even parathyroidism or hyper or hypo, and corticosteroid imbalances also sometimes create some kind of health issues in captive sloth bears. And apart from that, the regular gastrointestinal problems, dental issues, respiratory illness, joint issues like arthritis or even hygromas, and the reproductive issues, even sometimes we encountered pseudopregnancies and the mammary gland tumors as well. And the common age-old problems are like chronic kidney diseases, hepatitis of either viral origin or even any other infective origin. And a few skin infections were also encountered in captive sloth bear facilities. And coming to this tuberculosis, as we all know that Mycobacterium tuberculosis is the causative bacteria. And then in animals, especially, we encounter Mycobacterium bovis. But in our case, these are all from the rescued background, especially with the gypsies background. So they contracted the disease from people, and then they have eventually expressed the species of Mycobacterium tuberculosis instead of Mycobacterium bovis. So we got to know this through culture examination, and then we literally, I mean, whatever may be the tuberculosis, we have to follow the same TB medications. So apparently, we are doing the same kind of diagnosis and management with respect to control this disease. But the symptoms are very, very specific, like the inaptitude, anorexia, and gradual weight loss, purulent discharge from the eyes and nose when they were really in an advanced disease condition. Especially few weeks before death, we can expect these kind of discharges from their eyes and nostrils, but not very often. We used to find that. And lymphadenitis is another common symptom we always find. All the peripheral lymph nodes can be palpable, but it is very difficult to do a physical examination of any captive animals. But still, when we are doing them under immobilization or after anesthesia, then definitely these are all the very salient features that we can always look for. And diarrhea and deep thoraco-abdominal respiration is very uncommon, but still we will not be able to conclude just because of diarrhea it may be a tuberculosis, because in this species especially, we could not find any such kind of cough or even sputum coming out of the nostril in earlier stages. So we always suspect that the sputum came out of the trachea or even through the pharynx. It might have been engulfed by the animal, and then so through the oral route, or even if something is divided in their fecal content. So we always do a culture and staining process to identify if there are any mycobacterium, because they are very easy to identify through a stained slide. So it's another easy way of diagnosing the mycobacterium if they are voided in the feces. Of course, the PM lesions are very, very straightforward. You can see the pictures on the right side. The lungs are more nodular in lesions and large pus-filled cavities. And if you just put a nick, and you will see the congregation of the pus, and also this the caseous nodules everywhere, and a lot of calcifications because it is a chronic problem, and the congested trachea, and of course enlarged lymph nodes in and around the respiratory system, and pus all over the lung lobe is very, very evident. So it is very easy to identify a TB infected PM lesions when you are conducting any necropsy. And the usual diagnosis and management is just through chest radiography, a lung wash, because we used to put the tube, I mean, through the endotracheal tube, a clean, autoclaved, disposable tube into the trachea, and then ensure that there are a lot of mucus stuck into the tube, and then we put normal saline of 40 to 50 ml, and then immediately suck them back, so that this lavage will definitely carry some kind of bacterial load, and then we can easily get the diagnosis done through either staining or through culture. So the blood work is any disease diagnosis process, we always get into a basic blood work. But with respect to tuberculosis, it is not much evident. You will not be able to find the tuberculosis just by doing blood work until or unless it has become very acute or even a miliary condition. Otherwise, the body makeups everything, and then you will not be able to get any hemogram changes. And the other easily available test kit is the Wild TB Alert Kit, which is very easily available, and then it's a tabletop test. We can easily do a Wild TB Alert test kit with a drop of blood or serum or even plasma, and then the reading will be done in less than 1 or 2 minutes. So based on the symptoms, the treatment will be always an anti-tuberculosis drug, and then monitoring and providing supportive care and treatment is another important factor, and avoid the animal to get into any kind of stress. Even putting them into a squeeze cage or trying to do some kind of intensive treatment by putting them under an isolated area itself is a big stress for the animal. So the stress induces proliferation or even provoking the disease a lot. So it is very important to ensure the animal is stress-free as much as possible. Because isolation is inevitable. So we'll have to manage such things, and then exposing the animal to sunlight also gives us a lot of improvement. And with respect to anti-tuberculosis, drugs are like a combination of four anti-tuberculosis primary drugs called isoniazid, ethambutol, pyrazinamide, and uh, isoniazid, ethambutol, pyrazinamide, and one more is there, the rifampicin. Isoniazid, rifampicin, ethambutol, and pyrazinamide. Yes, four drug combination is available in one single tablet. Then we can go for that for the control of tuberculosis. The second important viral disease is infectious canine hepatitis, which is literally a per acute form we always encounter. And this is a contagious viral disease causing liver infection by this canine adenoviral infection type 1, and they usually have a incubation period of 4 to 7 days. And these symptoms are very, very, very specific, and the per acute cases or forms were only noticed by us so far, and then the death will be very, very sudden and very quick by just showing a convulsion. And by the time you reach the enclosure, the animal would have lost their life. So the respiratory distress was the one and only symptom we found with a convulsion. But in acute cases, the staggering gait, shivering, congested eyes, petechial hemorrhage in lips and gums, as you can very well notice in this image or the picture. And the PM lesions are very pinpoint hemorrhage in all the serous and mucosal layer of intestine, stomach, and all over the mesentery. So coming to the diagnosis and management, infection spreads through urine, feces, saliva, even through fomites. So it is very, very important for us to make them to isolate strictly, and then ensure that steam cleaning or even the flame gun or even quaternary ammonium components are used to disinfect the enclosure on a regular basis. And immediate isolation of the animal is very much warranted. And the supportive treatments with the immunomodulators, hematinics, vitamin C and E as an antioxidant will always help. Coming to the next important viral disease is rabies, and this we know the rhabdovirus, and then the incubation period is 7 days to several months, and the symptoms are very, very unique in sloth bears, whichever the rabies case we found so far in captive facilities are primarily looking like a dumb form of the disease, and they always have a labored respiration distress, pale mucous membrane, and inability to digest or ingest food. So vomition of undigested food material and off feed indicating the dumb form of the disease, and they never been aggressive so far in our captive facility. And then the post-mortem lesions were very, very clear, and then even the histopathology examination of the performed, the brain sample showed negri bodies. And the bear usually be dying once after the symptoms were shown within a span of 3 to 7 days. And the diagnosis is symptomatic, and then it's hard to suspect this disease until or unless we isolate them, and then if they cross more than 10 days to several weeks of quarantine or isolation. Morbidity and mortality was controlled only through immunization procedure by giving ARV vaccine and post-exposure immunization procedure, and followed by annual revaccination is the current practice in our facility. And then so far we haven't lost any bear because of rabies. The other most important disease in captive sloth bears or carcinomas. So these carcinomas are primarily either gallbladder or even liver carcinomas. And in our case, many of these either gallbladder disease or cholangiocarcinoma always exhibits a bulged abdomen, which is very big ascites, and then the animal stops eating, and then you can see a lot of icteric mucous membrane and even the skin, and then this axilla region, or even the ear pinnas get into a generalized jaundice, I mean yellowish depigmentation or even the coloration all over the body, and facial and peripheral edema according to the severity of the condition we always witness. Intermittent vomiting, causing mucoid brownish black scanty feces is another important symptom we always find. In the initial stage, there won't be any marked changes in food intake, but as days progress, the gradual inappetisance and intermittent anorexia will develop, which will lead to lethargy and general weakness. So the non-parasitic allergic dermatitis. So though if we are checking the skin samples or even fecal samples for internal parasites, there won't be any parasites, but still we could see a lot of allergic dermatitic lesions around the lips, limbs, and perianal region were also noticed in bears with hepatic pathology. So it could be a reason the hepatic insufficiency leads to this expression of other extra hepatic symptoms. But still, this needs a lot of study because all over the globe, I think wherever sloth bears are there and they are facing such kind of hepatocellular carcinomas with no specific reasons identified so far, except a few gut microbial changes and also the feed related reasons. But still, there was no conclusive reports as far as I know. And the dental issues are also very common because, as I said, our bears primarily are rescued from this performing background. So they always have this very bad tooth because they uh, rip off the tooth for their safety reasons. But without that, also in many captive facilities, we always see a lot of teeth related issues like fractured canines or even aberrations or caries in molars and premolars, and also a lot of root canal problems or even pulp exposed, and a lot of carcinomas like gigantiform cementomas and then osteoblastomas, or some of them I mean, isolated and identified and diagnosed in our facilities. And there are a lot of developmental dental disorders like malocclusions and other stuff that are also very prominent in captive sloth bears. And coming to the next few slides, I'm going to talk about this prevention and biosecurity, which is primarily made into four major parts: quarantine procedure, hygiene practices, pest control, and vaccination programs. And here in Bear Rehabilitation Center of Wildlife SOS, we always follow 90 days of quarantine facility, and we have structured that into 0 day. The animal should be put in a isolated environment because they are into a new environment, so that we can allow them to acclimatize and calm down and settle with adequate clean drinking water or ORS or even any kind of tender coconuts water, so that the animal will be in a calm subtle environment, so that it will get less stressed, or multiple people sometimes may lead to a lot of stress situations to the animal. So minimal people involvement, and then observing the bear for their behavior is a primary component of the 0th day. And first 15 days we will be observing for any illness, diseases, behavioral changes with respect to their vision, exhibition of pain, external parasites, all those stuffs. And the regular porridge or any kind of regular feeding practices should be slowly introduced to the animal, so that the animal will not have any kind of nutritional shock. And the fruits, because as I said, they are insectivore and also frugivore, I mean, myrmecophagy in nature, so we can introduce a lot of worms, insects, and also a lot of seasonal fruits and vegetables. Careful visual examination for the external body is very important within that 2 weeks. And then from 16 to 35 days, the animal temperament should be recorded based on observation, and initiating oral supplementation along with food. Fecal and urine examination gives us a major point with respect to their food and also their hydration status, and 36 to 45 days anthelmintic administration like any of these drugs like albendazole, fenbendazole, or praziquantel, ivermectin, doramectin. So any of these combination will be used in a cyclical way so that they won't get resistance. And topical acaricides like flumethrin and fipronil, moxidectin is generally we use to avoid the tick problems. And vaccination against infectious diseases like rabies, ICH, and leptospirosis, like a common canine 7-in-1 or multivalent vaccines are generally practiced. In 46 to 53, sorry, the number was wrong. So we do a chemical immobilization of the animal to check their samples, and then morphometry, all the recordings, and the vitals, and also the hydration status, and the regular auscultation, percussion, and special procedures like ultrasonography, chest radiography, TB test, dental check, echocardiography, and pulse Doppler, glucose check for diabetes. All those things will be done. And at the second month end, we will be taking a regular body weight, body condition score, is very important. And we definitely not a fan of crush or squeeze cage for sloth bears, because they tend to do a lot of somersaulting and then do a lot of self-injury. So we generally avoid squeeze cages for sloth bears. And socialization with other bears is also established between these 2 months period, and booster doses of vaccine and other necessary treatment based on the blood profile or diagnosed conditions can also be addressed. And the last month, we usually check the compatibility with other animal, and start introducing a lot of enrichment tools, and then practices. And obviously, operant conditioning of individual animal makes much easier once they are familiarized with their environment. And with respect to hygiene protocol, as we all know that we used to keep the enclosures clean multiple times, I mean, especially before food and then immediately after food. So whatever the number of times we are feeding them, it is important to ensure that there won't be any fecal contaminants in the feeding area, though we are feeding them in a individual bowl or a stainless steel plate to maintain the hygiene. And the good disinfectants, whichever is available locally, can be used according to the vet's preference. And also the meals should also be ensured that it is not spilled all over the enclosure. It should be in a clean, neat place, so that the animal will not contaminate, or even any other excretas will be contaminated with the food and water. So, and I just wanted to touch upon this enrichment, enclosure enrichment, as well as we all know that, which describes how the environmental environment of the captive animal can be changed for the benefit of their inhabitants. So the behavioral opportunities that may arise or increase as a result of environmental enrichment can be appropriately described as behavioral enrichment. And this increases the behavioral diversity to reduce the frequency of abnormal behavior like stereotypy, increase the range or number of normal behavior pattern, that is wild instinct behavior, increase positive utilization of the environment, increase the ability to cope the challenges in a more normal way. So anyone involved in environmental enrichment needs a good basic understanding of the animal welfare and the scientific evidence that environmental enrichment does indeed improve the animal welfare. And highest level of hygiene must be maintained whenever we are using a feed enrichment. So these are some of the stimulations. I like behavioral enrichment, what we usually use: toys, puzzles, varied environments, and helps to prevent stress, which can weaken the immune system and lead to illness. So addressing this environmental enrichment, a lot of behavior and health benefits for any captive animal, especially in. And that's a braid feeder, which is like a puzzle feeder. So the animal has to spend some time to pull out the treat from the fire hose hammock here. And then even in the other puzzle feeding, like a ball with a hidden peanut or even the dates inside. So they have to literally express and then come out of their natural behavior to get the treat, as well as they will get motivated to do such kind of activities. You can see it's a best example for establishing their computer skills. Like when we provide a coconut, unopened whole coconut, the bear tend to throw them up and down and throw them against the rock to open and then eat their treat. So it improves their activity as well as engage them to express natural behavior. So these are some of the protocols for the bear health assessment. So we usually check the feed intake, like every time we need to ensure that the monitoring of the feeding is happening on a daily basis by the vet in charge. And the appetite can be easily identified. I mean, the loss of appetite can be easily identified, and based on that, we can immediately get into a kind of intervention which needs either a clinical examination physically or sometimes even after chemical immobilization. And the nutritional supplements, as I already mentioned, it's very important and integral part of this nutrition management of captive animal. The standard body weight will also give a good clue that if they are good, then at least we can ensure that they are physically and psychologically well. And if it goes towards fair or poor, then definitely the veterinary intention is or the intervention is really needed. And then we have to ensure that their body score condition is within the ideal state. And you can see the skin and thin stuffs are really unwanted or symptom of low nutrition or some kind of illness, or even sometimes tuberculosis. But when it comes to overweight and obese, definitely we need to address the activity or even the environmental enrichments, and also the feeding schedule or feeding regime or even the energy level of the food has to be modified or adjusted so that we will keep them in an ideal body weight. And this is another important vocalization clue, which I always insist to the vets. You can hear the sound. It's a bear song, we used to call it, but this song or the sound represents they are very comfortable, and the sound or even the behavior may be encouraging their digestibility coefficient or even the digestibility process. But whenever they stop doing such kind of vocalization, we can always expect, okay, they are not in a good mood, or even they are not comfortable to make this sound. So that is also a part of the sickness clue. So what we understood from the captive sloth bears. And of course, we always have the fecal score is also one of the health assessing tools, and then the various varieties of stool qualities, like even the consistency, color, and then this components. Sometimes even the mucus food or very yellowish or blood mixed or blood tinged or occult blood or even parasites, which gives us a lot of clue. And then one should establish based on the feeding schedule or the feeding practices of the individual captive facility or the species. And these are some of the common gastrointestinal parasites we isolated, like Hymenopus, Capillaria, and Tricho, strongyloides, and Eimerias, ankylostoma. So these are the common parasites which we encountered. And in our operation theater, we always have a standard checklist so that whenever the animal is on the table, we complete all these practices, starting from basic vital check to blood sample collection to all the parameter checks by using specialized equipments like digital ophthalmoscope, digital otoscope, and also the pulse oximeter and body morphometry, and all the ultrasonography of abdomen or even echo or pectoral, and the chest photography for the individual V marks, because these of late we found and even we established a scientific paper that the individual V mark of individual sloth bear is very individualistic. And then if the by checking or by doing these kind of V mark print, then we can easily identify the individual. So such kind of things are very important. So collect as much as data as possible from individual animal when they are on the table, so that it can be a referral value and the reference material for the future species conservation, and also for a lot of vets to involve in this kind of species conservation in captive facilities. And I really wanted to tell you all proudly that we have contributed in Paulo's 10th volume and then a complete chapter called veterinary medicine in the rehabilitation of dancing sloth bears in India. So we have provided all the 20 years of experience in this 5 or 6 pages. So if anyone is accessing this, definitely you can get more information in this carnivore section 19, chapter 105, about all sloth bear related medicines, and also the transportation cages, all the parameters of blood, and then vital parameters, and also the anesthetic regime, and all the vaccination protocols, deworming protocols. Everything is given in this chapter. So if anyone is interested, I can even send you the PDF form of that chapter. So with this, I would like to conclude, and thank you so much. And I am really proud to enter into the 30th year of Wildlife SOS with long services in handling and then rehabilitation of displaced and injured wildlife of our country. And if you have any questions, I'm happy to answer.
Thank you, Dr. Arun, for your wonderful presentation and for sharing all the experience of yourself and Wildlife SOS. That's a wonderful presentation. There are many appreciations for you on the chat box. There are more questions also. There are 3-4 questions already there in chat box, but we may not be having that much time to respond to. So what we are suggesting is maybe you can just answer the first question, and later we will direct all the questions to you through email, and then that can be circulated with all the participants later. So the question reads like this. This is from Dr. Nirupama. Very nice presentation. I have 2 doubts. Is there any transfer of disease, TB, from infected bear to non-infected bear? That's question number 1. Question number 2 is also, how do you administer the medicine? Duration of medicine. Do they accept the medicine every time? So, please, maybe you can give a short.
Yes. That's a very nice question, Dr. Nirupama. I appreciate it. See, this is basically the reverse zoonosis what we are facing in this dancing captive sloth bear. So we could not prove that they are transmitting from one animal to other animal, because this is not Mycobacterium bovis. Though Mycobacterium or even tuberculosis in general is an aerosol infection, but we are not able to record any such kind of evidences that a bear has actually gone from non-infection to infective stage. And many a times we have seen infective stage to non-infective stage they have moved to, because we always give them this prophylactic anti-tuberculosis drugs. As I said, this isoniazid, rifampicin, ethambutol, and pyrazinamide combination. And as per the human pulmonologist, because this is the human tuberculosis, which is Mycobacterium tuberculosis, so we took a lot of guidance from the human pulmonologist, and then based on their version, what we are currently following is weekly 3 days regime of anti-tuberculosis drugs to all the animals. And then we are very much in control of this disease, especially in our captive animal facilities, because we have multiple numbers. Like in one enclosure, in one rehabilitation center itself, we have 100 animals. The other place 60, the other one 40, the other one 30. So with this large number of populations, it is very, very difficult to say that whether they are contracting the disease between individuals. But still, we are keeping them in group quarantine practice whenever we are suspecting someone has died of tuberculosis, especially after their geriatric age, like 20-25 years. So we always keep them isolated, and also ensure that the other animals are all getting this a prophylactic anti-TB regime, like 3 times a week for 3 months. So this will be the regime what we are following as per the human pulmonologist, and we are getting better results, and we are not losing those many bears until or unless they are really, really aged, and then there are multiple vital organ dysfunctions, which leads to the stress, and then that stress leads to increase in the tuberculosis infection. And your second question is whether they accept the medication or not is a very big challenging question, and it is challenging for us to even make the animal to eat the medicated food. But of late, we have got these medicines, anti-TB medicines of pediatric use, which is really a nice flavored tonic base. So now all the bears of our facilities are accepting that. So that is the big boom for us, because previously when they were pills, they were refusing to eat, and then they refuse the food for weeks together. So generally that leads to stress. So we again resume the medication out of the food, and then they take only the plain food. But now with this syrup form, they are all eating the anti-TB drugs, and which is very much ideal because it is meant for babies. I mean, the human infants for this primary complex or even tuberculosis, early infections in kids, in human beings. So that particular form of the medicine, what I mean is this syrup form is very much acceptable by these animals.
Thank you, Dr. Arun. There are a few more questions, one from Jacob and Dr. Azad, Dr. Jacob and Dr. Avjit. I will direct all those questions to you through email, and later we'll just circulate.
Sure.
This has to be done because for want of time, we need to just, thank you so much. Thank you very much for your presentation.